Hello, Namaste. I am Dr. Subash Sharma, resident of Nepal. Right now, currently working at Surkhet at Karnali Province Hospital. So basically, I have joined this neonatal and pediatric echo 6 months back. Initially, there were 14 to 15 modules, and from those modules, I got to know a lot of things regarding the basic theoretical and practical things regarding echo. Before this course, I had seen many websites and all which were very incomplete. But after I got through those modules, I came to know about this program. So I got enrolled myself. And then for hands out, I was invited to New Delhi at with Dr. Kohli. So initially, since I'm a foreigner, but I was never treated as a foreigner in this country. So with a warm welcome from Dr. Kohli and his team, though I was anxious and nervous, I had to travel whole night by bus, but the enthusiasm which this institute and which Dr. Kohli gave me, it was so much of relief. So there was a warm welcome, warm tea, and after that, at first when I thought about Dr. Kohli, I thought a big man, he might be very egoistic with a lot of discipline. But when I got to meet him in the first sight, he was a very down-to-earth man, very friendly, catchy. So that helped us to know more about this. So regarding this hands-on training, initially we have gone through many videos, but none of the videos is worth than a proper hands-on training, I feel. So theoretically, any videos can teach you anything, but unless that is compiled or put together with hands-on, then only there is effective teaching. So initially, theoretically also, when we met Dr. Kohli, he had all those heart modules and all, so which helped us to know even heart even better anatomically as well as echo point of view. So from the first day, we learned all the 4-chamber view, 5-chamber view. Then we learned long axis, short axis, and even arch view, and also subcostal view. So all those views merged, which seemed very difficult and very uneasy. But when hands-on went with Dr. Kohli, all those views became very easy. So slowly by slowly, so I am very amazed that even though this is a private clinic, Dr. Kohli did not leave any patients, and we had chance of hands-on on each and every of his patients. So we are very happy. On top of that, I got very surprised to know that many typical cardiac cases which I thought were incurable, we would have told that there is hardly any chance of survival. All those difficult cases are also being treated by Dr. Kohli and his team. So that gives a lot of hope to those families and parents who had failed to know about this various untreatable cardiac cases are also treatable when it is accompanied with Dr. Kohli and his team. So besides this, 3 days of hands-on was so much, including the neurology part about Doppler, color flow, everything to know more about echocardiography. So this has increased my interest in cardiology by more than 10 times. So I am very warm-whelmed by this help from Dr. Kohli and his team. So in a short time, I have got to know many more things regarding this echo. Well, this echocardiography is just a beginning, so I have to go a long way to know more and to specialize more. So I hope Dr. Kohli and his team helps me more. Saying this, this Delhi Heart Center, this is very effective to help even those poor needy patients through the NGO for treatment of this cardiac disease. So I wish all the best to this Delhi Heart Center and to Dr. Kohli and to all the patients. I thank them who gave me opportunity to do hands-on them and the parents. And overall, thank you, Dr. Kohli, and Namaste.